The first wave of vaccinations is spoken for, but who should be next in line? Good evening and thanks for joining us for 7 Action News at 6. I'm Alan Campbell.
And I'm Carolyn Clifford with final authorization of the Pfizer vaccine expected at any time now. Attention is turning to who will get the shots after healthcare workers and people in nursing homes. The meatpacking and food industries are among those lobbying right now to get their workers first in line. The Airline Pilots Union is also pushing for flight crews to get priority.
Tonight, 7 Action News reporter Kimberly Craig has a look at how the distribution is expected to unfold right here in Michigan.
Because the first vaccine allocations will be limited, prioritizing and patience will be key.
Anyone that's been classified as an essential worker through this past year, seems like they would be next in line.
But according to the chief medical executive with the Michigan Department of Health and Human Services, determining who is essential is a bit more complicated than just who has been working through the pandemic.
This is not first come, first serve. This is about principles and principles of keeping critical infrastructure open.
Phase 1 of vaccine distribution in Michigan will include people who are paid and even unpaid, serving in healthcare settings who have direct or indirect exposure to patients or infectious materials. This will include EMS workers,
staff working on general medical floors, in emergency departments, and intensive care units.
State health officials say a number of other workers in the healthcare field will also be included. Then K through 12 and child care workers and others in direct contact with children. Then workers in what's considered critical infrastructure, including whose work involves chemicals, communications, emergency services, financial services, government facilities, food and agriculture, nuclear reactors, and water and wastewater systems. It will not be everyone in these industries who gets vaccinated in phase 1.
We are identifying who the really critical people are to keep the very minimum functioning. So that may be different based on the industry, based on the company. It will be very different.
Restaurant workers, grocery shopper workers, mostly because we're still going to Walmart and to Myers and everywhere else.
But much will depend on the age and health of workers in each industry, and there will only be so much vaccine available.
So if there's only a certain amount available for a local health department, these industries will have to pivot and they will only have a certain amount available, and they'll have to identify who those critical infrastructure workers are to receive the vaccine.
And Dr. Caldoun says they hope to begin offering the vaccine to the general public by late spring. Kimberly Craig, 7 Action News.
Nearly